Well, welcome. It's my pleasure in this series I'm calling Reflections from Pharmacy Leaders in Advancing the Profession to have with us this morning Dr. Mary Beth O'Connell, who's professor of pharmacy practice at Wayne State University in Detroit, Michigan. And she's also a faculty associate with the Wayne State Institute of Gerontology. She's recognized as a leader in geriatric pharmacotherapy and education. She's known for excellence in teaching and innovations. She is a contributor to DiPero's pharmacotherapy textbook and is also the author of a key text titled Women's Health Across the Lifespan, a Pharmacotherapeutic Approach. Of course, she is a past president of ACCP, the American College of Clinical Pharmacy. So welcome, Dr. O'Connell.
Thank you for letting me join in your leadership course. It's so important. You know, I think it would have been nice back in our education times to have more of these things. So you're really doing a great service to our profession, because change only comes from leadership, and you're going to have a great group of leaders coming from your college.
Thank you very much. So we'll go ahead and start off with, we would like to learn more about your journey in your career and recognition as a leader, and reflecting on that, you may wish to include key events or key people that influence you in that journey.
Thanks. You know, it's a good time to just stop and think about where you've been and how you got there. So, you know, I encourage my students and advisees to be part of organizations in college, and that's where I started as well. So I went to Wayne State University and I got my BS in pharmacy. The second year I became the class president, and then I was also active in LKS and ROCI. So I'd say my leadership training really started at the College of Pharmacy level, and it just continued to grow from there. Back then I went to, did a residency at Harper Hospital, and the administration there was very active in ASHP. And we also had the Michigan chapter and the Southeast Society of Health System Pharmacists. And so I tagged along. So I'd encourage people, I know we're supposed to give advice at the end, but tag along with people who are leaders in these organizations, and you can learn how to be passionate and a change agent for our profession. From then, I then went to get my PharmD, and I went to University of Minnesota. At that time, ACCP, the American College of Clinical Pharmacy, was just getting started. And most of the Minnesota faculty were active members and on the board. In fact, one or two of them were actually the founding members. And so I joined and quickly became immersed in this really passionate group of change agents, because back then, being as I'm gray now, I've been in the field for 40 years, clinical pharmacy was still actually a new field of practice. And a lot of the shakers and movers were actually part of ACCP and ASHP. So I had all these leaders. I can't pinpoint just a specific one, because I think I learned from every single person I come in contact with. After that, I went to the Ferris College of Pharmacy, and I learned that their students, graduates, were very active in the state, and they actually knew all their legislators. And I was really impressed by that, because in order to create change, a lot of that comes from advocacy at the state and the national level. And so it's really important. And I've tried a little bit to help create advocacy training within our college, but we also get that with our state associations. So that's a critically important piece, to get to know your legislators as well. From there, I then went to do a fellowship. So I don't have the normal route of progression. I kind of went, practiced, saw that I needed some additional skills and training, then went to do some training, and then got some different positions, sorry about that, as well. So from the fellowship, then we started doing scientific discovery, did some teaching, and also went to national meetings, and this time to present science. And again, became involved with other sort of researchers who are not only doing intervention studies, but we're doing health service studies to progress the field of pharmacy. And when I was finishing up my fellowship, University of Minnesota had a position, and it was actually for an associate level position. and the person they offered it to decided not to take it. And my advisor, Gary Matsky, who still advises me to this day, encouraged me to put my name in. So from that, I learned stretch high. You might think that you might not be able to do something, but put your hat into the field and see. Surround yourself by people who are better than you, because you're going to rise up to their levels to do that. And I actually got fortunate enough to be hired on at the University of Minnesota. University of Minnesota is a change agent school, and it fit me quite well because I'm really all about change. And during that time, I became involved with the Minnesota Society of Health System Pharmacists, ASHP, and ACCP. I find that one of the questions was, who's been important into your life? And I would say every person I've met has been important to my life, and because they helped me become better in all aspects of my career. So you have your dean here, Dean Poirier. I would say when I was reflecting on her, she's one of the first people I knew who was really the advocate for pharmacy education. I was really more on the practice side and the pharmacy organizations. But your dean has been very active in terms of education, setting reform and standards. And so people like your dean helped me become a better teacher as well. And with that, I also became an innovator of education reform as well. And so I have one of those, not a single focus or silo. I tend to like everything and work in everything, which is not always the best way to do it, but for me, it's actually worked. So I continue to work hard within the Minnesota Society of Health System Pharmacists and ACCP, starting out as being a committee member. And then I became committee chairs, and then went to a different committee, and then I became on the board, and then I became the president. So I had these leadership progressions really from just getting involved and accepting the challenge and getting to know people. While I was at Minnesota, there was some non-sexual harassment issues, and it caused me a time to reflect. And I decided life was short. You have to stick to your values, and one of my values was family. So when I decided where was my next academic career, because I love working with students and helping them achieve their goals, I came to Wayne State University. And here I continue to get involved with interprofessional education and practice, and being a change agent in that area. So I'd say one of my big keys to success has been organizations. I see organizations as, I call it vitamin O to my students. I go to a meeting, I get a loading dose at the convention. It energizes me to improve every aspect of my life in terms of practice, teaching, research, and organizational activities. These meetings provide me contact with other change agents. They provide me with new ideas, and that I see it's just a win-win. So I give, and I keep telling my students, the more I give to the associations, the more I get back. So that has been my journey.
Very good. Thank you very much for that. What do you think will be your legacy in 20 years? And I rephrase this question because people get intimidated by legacy, is reflecting on your journey and your contribution. What are you most proud of in terms of your contribution that has helped advance the pharmacy profession?
I think I will look at it at each facet. So in terms of teaching, I believe in the student. I believe in being an individualized teacher to help each person achieve their success. So I guess I'm most proud in teaching in terms of being innovative for interprofessional education for the last 22 years, right at the beginning. Coming to Wayne, I started a journey on how to help students become more culturally competent, which I think is an essential skill when we're working with our diverse populations, and to actually understand and work to resolve health disparities. And then I am pretty proud of the textbook. It was a group effort, not just me. But yes, 50% of 50 to 51%, depending on what you're looking at, of patients are women, and women are different, and we're just beginning to understand the differences of sex and gender. So I think this is important to bring that to the forefront. I also work with Kappa Epsilon at Minnesota and LKS at Wayne, and I'd say those are my proud moments because I get to work one-on-one individually with helping young women achieve their potential in research, in research, teaching, and practice.
Very
In
good.
terms of research, was one of the first to document the proton pump inhibitor interaction with calcium carbonate absorption.
Mm.
So that was pretty exciting. And I just published a paper on using community pharmacies for interprofessional education. So continuing to push the envelope both in terms of practice and in terms of community pharmacies. In terms of practice, I've been a women's health and geriatric advocate before they became specialty areas, and helped with becoming one of the early adopters in terms of ambulatory care. By MSHP, we worked on changing the Pharmacy Practice Act, one of the first to do that. And it was a team effort, and we got unanimous support. And then during my year of ACCP as president, that was the year we put forth the first legislation for advocacy for provider status.
Mm.
It was way back in 2002.
Wow.
It's still a little bit disappointing that we haven't achieved that, but I think together we can, and we're making great progress. And back at that time, we also made the statement that everybody should have a residency before practice by the year 2020. So it's 2020 now, and we're getting there. We have many more residencies, but I'm a big fan of residencies. So I hope that would be my legacy.
Very good. That's great. Thank you. So you've been giving us advice for students, but more advice for students in their journey, especially as they develop as leaders.
I think one of the sayings I mentioned to my student advisees, too much is given, much is expected. It's still a luxury to get a college education for many and to be in the healthcare profession. And we actually make really good salaries. So from that, I think it means that we need to be actively involved, not only in our professional organizations, but in our communities as well. I would say pick a cause from a specific disease to a practice reform and become an advocate. You can join a local support group for any sort of disease condition or a national organization. I work with the National Osteoporosis Foundation. So I think it's important to volunteer outside of your position. And again, the more you give, the more you get back. To be culturally competent, you need to be active in your community, understand the patients that are coming to your pharmacies, and being that visible role. Frequently when we go to advocate, patients and legislators can be our biggest advocates, but they don't always know what we actually do. So be the face of pharmacy and help encourage others to help us be able to practice at our active level. And of course, I can be active in your local or state organizations, and if you can, at the national organization. And I think the final piece of advice would be to believe in yourself that you are a leader, because you are. Spend some time with developing your leadership skills. Whenever I go to a state or national meeting, there are always leadership CEs, but there's hardly anybody in there. It's easier to learn about a new medication or how to treat a disease state from all our literature that we have, but it's really harder to develop those leadership skills. So try to attend 1 to 2 leadership activities when you attend a national meeting. Learn how to resolve conflict, learn to work to get to the win-win solutions. Surround yourself with other leaders and successful people. They will pull you up and they will help you help your dreams come true.
Very good. Thank you very much for those. So as this is a history course and we're studying the evolution of the profession, when we study the decade of the 2020s, one of the key events in that decade will be COVID-19 pandemic. And as other key events that have occurred in history, those events that occur outside of our profession shape our profession. How do you see the COVID-19 pandemic really shaping our profession and being an opportunity for our profession?
That's a really good question. First off, I think if you haven't been a military pharmacist, this is the first time that you've been put into a situation where you could actually die from providing care, because at the beginning of COVID, we did not have enough protective gear, and we still don't have any cures for it. So I think it showed the bravery of our profession. It showed the intelligence, because we had medication shortages, we had critically ill patients with a disease and also had other chronic conditions. And there was also the science that we stepped up to help participate in creating the evidence to dictate change for the future. We began adopting telehealth practices for those who are working in ambulatory care. And in fact, sometimes they were the key agent in the clinic because all the hospitals and nurses were in the hospitals. And so they were taking care of patients. And in the community pharmacists, they figured out very quickly how to get medications to patients safely, how to get 3 months supplies. Many states, pharmacists were giving advanced practice responsibilities through state orders, and they created these testing centers. So I think we stepped up to the plate and showed that we were a valuable part of the healthcare force. However, once this is calming down, we need to then work on the advocacy pieces so that all states can have advanced scope of practice activities to allow us to continue to do the professional patient care activities we were doing during COVID. So I think this opens the door to show that we can do more than what we have, that we're a critical component of the healthcare team, but now we need to continue to push for that to become part of our standard practice.
Very good. Thank you very much. I really appreciate. Again, thank you for your time.
Thank you, and wishing great success to all your students. I hope you change the world to continue to make pharmacy a greater profession and patient care to have greater outcomes.
Thank you.